Many people living with hepatitis B have carried a heavy burden in their heart for decades because of one message: there is no cure. That single sentence has created fear, silence, stigma, and in some cases, people avoiding the care they need. But the truth in 2026 is far more complex and far more hopeful than what many were told years ago. If you are living with hepatitis B, or you care for someone who is living with hepatitis B, it's important to understand this clearly from the start, that the science has moved forward, not a little, but significantly. And today, the greatest danger is no longer the virus alone, but late diagnosis, poor follow-up, treatment interruption, and outdated belief systems. More than 250 million people worldwide are living with chronic hepatitis B. Most feel completely well. Many have no symptoms at all. Yet, hepatitis B remains the leading cause of liver cirrhosis and liver cancer globally. Not because it cannot be controlled, but because the control often comes too late. Chronic hepatitis B persists because the virus establishes itself inside the liver cells. That biological reality has not changed. What has changed is our ability to suppress the virus, protect the liver, and allow people to live full and normalized life when care is structured and consistent. Today's international guidelines from the World Health Organization and the American Association for the Study of Liver Disease and the European Association for the Study of the Liver is clear. Not everyone with hepatitis B strictly needs treatment immediately. Care is now based on thoughtful assessment of viral load, liver enzyme activity, degree of liver fibrosis, age, and individual risk factors such as family history of liver cancer. This approach prevents unnecessary lifelong medication while ensuring that patients get lifelong care. When treatment is indicated, modern antiviral therapies is extremely effective. Oral medication such as tenofovir and entecavir are taken once daily, are well tolerated, and suppress viral replication to undetectable levels in the vast majority of patients who take them consistently. When the virus is suppressed, liver inflammation settles down, fibrosis is stabilized, and the risk of cirrhosis and liver cancer drops dramatically. This is not experimental medicine. This is standard care across the world. One of the most damaging misunderstandings about hepatitis B is the belief that long-term treatment means failure. No. In reality, global liver societies are explicit about this. Sustained viral suppression is a successful outcome. Chronic hepatitis B is manageable, just like hypertension and diabetes, not with short course of drugs, but with long-term control to prevent irreversible complications. Another major shift in hepatitis B care is how the word cure is now used. Medicine now clearly distinguishes between complete cure and a functional cure. A complete cure, meaning total elimination of all viral genetic material from the liver, is not yet available. A functional cure, however, means sustained loss of hepatitis B surface antigen with stable liver function after stopping treatment. In practical terms, this means that the immune system keeps the virus under control without ongoing medication, and the long-term risk of liver disease comes close to that of someone who has already cleared the virus naturally. This is no longer a theoretical concept. In recent years, hepatitis B cure research has entered its most promising phase in decades. New therapies are being designed not just to suppress the virus, but to silence its proteins and restore effective immune control. In 2024 and 2025, some of the most important advances have come from combination strategies. In China, regulators approved the first drug specifically meant for achieving functional cure in combination with existing antiviral drugs. In clinical trials, a significant proportion of patients achieved sustained clearance of hepatitis B surface antigen even after stopping all medications, a milestone that would have been unthinkable just a decade ago. At the same time, therapeutic vaccines are being studied to retrain the immune system to recognize and eliminate infected liver cells, while capsid assembly modulators and antisense therapies target different stages of the virus life cycle. Even gene-based approaches aimed at disabling viral DNA inside liver cells have entered early human trials. Together, these advances represent a strong momentum in hepatitis B cure research that has ever been seen. But it's important for you to understand at this point that these treatments are not yet available in the open market. Hence, nobody should stop its treatment because they are waiting for a cure. What this do represent is that there is a clear shift in direction. The goal of functional cure is no longer a distant reality. It's now an active scientific objective with measurable progress. For people living with hepatitis B today, the message is both realistic and hopeful. You do not need to wait for a cure to protect your health. With early diagnosis, proper monitoring, and correct use of current antiviral therapies, most patients will never develop cirrhosis or liver cancer and can expect a normal life expectancy. The greatest strategy in hepatitis B today is not the absence of a cure, but the absence of action. In 2026, hepatitis B is no longer a disease of hopelessness. It's a disease that demands early testing, structured care, long-term follow-up, and scientific honesty. And for the first time, it is also a disease with a visible path to a functional cure. If you are living with hepatitis B, your future is not defined by fear or outdated beliefs. With the tools we already have and the breakthroughs now unfolding, living well is not a hoax, it's a standard of care.